them around
think
him
of
a little
that.
bit sometimes, because we talk about that. We're like, nah, that's the teacher, but it's also my kids there.
Sure. Like with the setting that I work, the capacities that I've worked in, and like my own personal history, like it's crazy. I was a case manager at this community-based correctional facility where we do like CBT treatment for people like instead of them just going to prison. Right? So like I have this person who's coming in on my case who's been mandated there by the state of Ohio, who's much more powerful than I. Yeah. So I went to high school with this person. I'd used drugs with this person, and I was in a residential men's like treatment facility with this person. And then fast forward 3 years later, right? Like I'm on a different track in my life, and he's like had some recidivism stuff going on. And now we're like, by the way, you guys will be working together in this setting. Hope that doesn't bother anybody. Because he's been court ordered here, and you're the only person that's on this track that he's on right now. So I was like, oh God, man, it's wild. Really wild.
I went to the doctor last week, and one of my colleagues was actually there shadowing my doctor. Like,
Oh my goodness.
Is it okay if they don't come in because we're not that yet? So
We're not
that is
there
something
yet.
that
We're not there yet.
I didn't think of that. All right, I want to be sure that Stephen has a chance here tonight, and that he doesn't have to continue waiting longer. So again, hopefully issues we're going to be able to pick up again in discussions, but he's been so patient. And I have to say, I'm really curious as to what this is going to look like. So.
Anticipation. It'll be a little different, I suppose, but.
All right. Good.
Go.
Hi,
Hi,
Stephen, it's nice to meet you.
Madeline.
Great, Madeline, thank you for coming. Please take a seat.
Great.
So, once again, I really want to thank you for taking your time to meet with me today and kind of share some of your experiences. Before we begin, I really just want to kind of go over what we're going to discuss in the interview, kind of the purpose of why you come in today, and just, have any questions beforehand, let you ask them, and just clarify things ahead of time. That's all right with you.
Okay, sounds good.
Great. If at any point I'm speaking too fast or you need clarification or just a random question comes up in your mind, just ask me to stop and I'll be happy to answer them as best I can.
Okay.
Okay, so the purpose of today's interview is really to allow us to get a better sense of your community and some of the health issues and concerns you may have as a resident of Benton County. We're doing this research and we're doing many interviews similar to this. We've already distributed surveys, which you may have already responded to, which was great if you did. And we also hope to have public town hall meetings and focus groups later in the project. Ultimately, what we see the goal of this research is to really guide future health initiatives here in Southeast Ohio in any way that we can. Now, the interview itself will be brief. It's only going to take about 10 minutes. But that being said, what I have here with me is the informed consent. And all that is a document which explains the associated risks, benefits, and kind of the purpose and details of the study. Now, I want to remind you that we're not going to be taking down any identifying information, so anything you say or mention in the interview will remain anonymous and confidential. That being said, the only information we will take down is your age and your gender, and that's just for basic demographic information.
Okay.
Now, what I'd like you to do is just take as long as you like, make sure you are comfortable with this, read through it. If you have any questions, please feel free to ask. And if you'd like to participate, to go ahead and sign a date on the line on the next page at the bottom. And if not, it's completely fine as well. So,
Great. Thank you.
okay.
Thanks. Okay.
Okay, great. And I will keep this copy for our records. And here's a copy for you. Now that has all of our contact information on it. So at any point after the interview, if you feel like you have other questions, or perhaps you feel uncomfortable with something you mentioned, or for whatever reason you feel like you would just rather your interview be omitted, that's completely fine. Contact us and we'll be more than happy to go ahead and do that right away.
Okay.
Okay, so then we'll go ahead and get started. And before we begin, just for the sake of accuracy, do you mind if I take an audio recording?
No, that's fine.
Okay, great. Set that up. And then we're going to go ahead and get started. And I'd just like to begin by getting to know a little bit more about yourself. Could you please tell me how you earn a living?
I am a third grade teacher, and I work in the elementary school here.
Okay, Great. And do you live alone or do you live with others?
I have a son and a daughter, and then my husband, and we all live together.
Great. And how long have you been a resident of Benton County?
About 5 years.
Okay. And I'm going to ask the question no one likes to answer, but I'm going to ask it anyways, is how old are you?
31.
31.
Yes.
All right. And now I'd like to ask a little bit about your experiences receiving and accessing medical care here in Benton County. Where's the closest available medical care facility for you?
There's a family center near here, but as far as hospitals, we have to go to Logan or Athens.
All right. And are you able to go to the hospital doctor regularly as you need to?
Yes, we do have transportation, so we're able to get there, but sometimes it's hard because we have to wait a long time, and depending on what we are requiring service-wise, we are told to go to a different county because they don't have all of the specialists needed.
All right. And are there other health services which are available to you within the county?
Yes, we do have eye care, and then there's some limited dental services.
All right. And now jumping to a different thing of questions, what would you consider a health emergency?
Well, if my husband were to have a heart attack, that would definitely be an emergency. He does have high blood pressure, so that would be definitely something that I would worry about getting an ambulance here quickly enough.
And in case of emergency, what would you do? What are your steps of action?
Well, in that case, I would call 911, and then other emergencies, we would go to the ER ourselves. We would be traveling to Logan or Athens.
And how would you say you typically characterize your own health?
We try to be healthy.
Of course.
We try to eat as well as we can, and we do some physical activity as a family. We like to go bicycling, but just a fair amount, I would say.
And where do you typically buy food and groceries from the week?
Well, we normally travel into Athens. We go to Kroger. Other than that, there are some farmer markets, and there's a convenience store that we can get, milk and eggs, but nothing too special.
And do you feel that you have access to healthy foods and fresh produce here in the county?
I would say it's a little limited.
And are there health issues in Benton County? And if so, could you please speak to me about what they are?
I would say that there's some obesity. I think education and access to foods is definitely a big problem. And unfortunately, there is some drug issues.
And do you have health concerns for yourself or your family members?
Well, I'm a little nervous because my children are going to need braces, and I don't know if we'll be able to get that because, as I said, the dental access is limited.
And could you tell me one thing related to health in Benton County that works well?
I would say that we have a good community basis, and everyone is really supportive of one another.
And could you also tell me one thing related to health in Benton County which could use improvement?
Probably access to things such as, flu shots and vaccines. Getting physicals for kids is kind of difficult.
And we're almost done with the interview, but is there anything you'd like to tell me? Is that anything related to maybe the questions we've gone over so far, or maybe just health for Benton County in general, or yourself?
Not right now, but I'm really excited for this, and I hope that it actually works out. And I know that you had mentioned the town meetings, and I'd be interested in going to that.
Right. And of course, it's our ultimate goal that this benefits the communities of Benton County in whatever way that it can. And we plan on having town hall meetings sometime within the following month. They will be in MacArthur. They'll be open to the public. Everyone from the county can come. And what we plan to do is really share some of our preliminary results once we've kind of finished going over the interviews that we have and collecting survey data. And we've had time to go through that. We'll be sure to, as we get closer, send out emails and flyers so everyone know exactly where and when it's going to be. But it's really going to be an opportunity for community members to see kind of what we are seeing as trends, and then hopefully gain some further insight from that, as well as maybe some next steps to go with this.
All right, great.
Great. So before we wrap it up, is there any last minute questions you have, or anything else I can help you answer?
I don't think so, not right now.
All right. Well, in that case, once again, thank you so much for joining me today and sharing, obviously, your experience and your opinions. And if you have any further questions at all, feel free to contact us, and we'll certainly keep in touch about the town hall meetings that are coming.
All right, thank you.
Thank you. A little quicker than we intended, but
That's okay.
Okay. So I do have some discussion questions, and they really are like, what is the big difference between my interactions with, we don't call them clients or patients, community members are probably the word you use, or just a participant in general. And I'm doing this from more of a, we're doing this in conjunction with a university perspective. People do this outside of it, but what are kind of the big differences between this and some of your skills?
It doesn't seem like their main goal is like individualistic for them. It's more like a community health mission. So it's not necessarily she's involved in it, but it's more her.
Right, and it really is like, people will obviously send out surveys ahead of time, usually to get a lot of sweeping demographic background and a lot of information. And then you could design interview questions based on some of the results from those surveys if you want to be more concentrated, or you could just go straight into qualitative interviews, but that's a lot of work, so they're usually limited in number. But it's also, it's important to kind of keep in mind that it is about the person you're talking to, because each of those individual experiences you have really relates to the larger whole of things, but at the same time it is also trying to get a much larger picture of a population that you're speaking with.
That's something I identify with as like social work, the macro level of social work advocacy, kind of advocating on a broader scale to implement social change via policies and implementing programs and things like that. It kind of seems like that lines up with what you do.
Yeah, it's definitely probably the most similar to social work in terms of at least stylistic aspects. And then I thought of this, does the Segway framework truly work with perhaps a public health perspective? I had a hard time making it. I mean, it does in a general sense, because a lot of the steps are the same. People, greet you properly, you elicit the same kind of information, your goals are the same, but in terms of perhaps some of the technical language, it is quite a little bit different. But I just wondered what you guys thought, if the Segway framework worked for that.
Well, I thought that, it also, thinking about research as a whole, would be something where you could kind of use the SEG framework more when you're debriefing or when you're talking about what you're doing, but, you still have to keep, quiet, because in terms of, I don't know your research, but in terms of clinical research for us, you can't spill the beans and tell them, everything that you're trying to figure out. So that would be something that would be hard, because you can't disclose everything.
Right, and typically unless there's a level of deception which is approved in just social sciences, it is full disclosure. That's why I made a mock informed consent, which I've used before, and made sure I wrote across that it's not the real one if I ever went back to it. But everything should be out in front of the person so that they feel comfortable and agree to participate willingly. And then, what are some outside factors that you think have influenced this experience? I mean, a lot of factors influence your interaction with a client or a patient, or just a person in general, but to me, I find there's some very specific ones that kind of influence how this conversation goes, or if it goes. And what do you think those are?
I know if there's like a pre-test or pre-survey, a lot of times that can sway people's opinions. We're going to talk about this. Okay, so what do I want to think about that kind of thing? Versus straight up being like, oh, so this is what we're going to talk about. I know that can influence. So that could be.
I did my outplacement in MacArthur. So I traveled to the county every week, and I saw all of the pretty little things there. it was very, it reminded me of an old time community where, you know, you've got the mom and pop shops, but there's nothing as structured. So I think that it would influence, you kind of wouldn't want to talk specifically about MacArthur, because they're also, like she said, a lot going to other counties. But also the people that live there are very, you know, they've grown up there, a lot of them, or they've, you know, they've got family businesses is a really important thing there. So I think tying that sort of culture into it.
Yeah, and those are big things that you take into consideration when you format your questions. When you think of how are you going to do the interviews? Are you going to, obviously she came into me this time, but that may not be realistic. In some settings, you go to them, and how does that work? Do you go with somebody so they can kind of introduce you? Do you just go on your own? There's a lot of things that, this was kind of a very general overview of what a very vague health assessment might look like, but a lot of times it's a lot more guided and a lot more informed by, you know, a lot of research and experience, and I was just kind of basing it off what I know, having grown up here.
Stephen, I was thinking that for all of us, I think anytime you have an encounter with a client, patient, whatever, you're also dealing with their history with either someone like you or someone in a related health profession. So if they've had a negative experience before with a nurse or a doctor, they're bringing that into this encounter, and sometimes that can be really tricky to have that burden on you. And they may not disclose that right away.
Right.
So you're not sure exactly why it is they're, you know, uneasy or they're not talking to you or whatever it is, but it turns out, as